Today we're going to be doing a kind of a journey of your life as a nurse. And so from school all the way through travel nursing, COVID nursing, and all of it. So just answer the questions honestly. State your name and credentials.
My name is John, and I was a BSN nurse.
Can you tell us what the difference of a BSN nurse is?
A lot of people just associate RN as a registered nurse, which a BSN is. BSN stands for Bachelor's in the Science of Nursing, which is a bachelor's degree. It used to be a lot of RNs were just associate's degrees or certificates with hospital training. So mine was, I guess, a step above.
What's an LPN?
Licensed practical nurse, so they operate under a nurse's license and they can pass meds and do some charting. There are certain things they can't do, like push IV medications or start drips, stuff like that. So you see a lot of LPNs in nursing home settings.
Are you currently a nurse?
Well, I'm still have my license, so technically yes, I'm currently a nurse. I am not working as a nurse currently.
And when did you stop nursing?
3 weeks ago. So it would have been the first week of April was my last day as a nurse.
So for viewers, what month and year is it right now?
Right now it is May 2021. Well, nursing wasn't actually my first major, I guess. I originally enrolled in Purdue for radiology technician. After the first year of schooling, they lost their funding for the radiology technician program, so that first year was kind of a wash. And I had to kind of scramble and decide what I was going to do next. And they had a list of all the degrees that would transfer all of my prereq credits over. And I waited until the last minute because I didn't know what I wanted to do, and I was having a party with some of my friends who were in the radiology technician program, and we all had to make a decision, and I closed my eyes and pointed, and it landed on nursing, so that's what I went with.
Looking back now, knowing what you know, would you have gone to nursing school or gone to college?
I may not have gone to college necessarily. Probably would have went to a trade school. I know I wouldn't have gone into nursing. It wasn't even my first choice. I really like the radiology technician program because it's more dealing with machines and I have more of a mechanical mindset. I think looking back I would have done a trade school, welding, something like that, because it's not as expensive and you make pretty decent money. I don't think I would have gone the same path had I had the opportunity to do it all over again.
When you were in nursing school, did you feel like they kind of pushed the ideology that you were becoming a nurse to help people?
Well, I mean, yeah, that's what it's all based around, is the Florence Nightingale. They're always there to help people and to get crapped on and just to take the brunt of it. And I don't know, that's definitely the ideology that was pushed in nursing school. I mean, because that's what the core base of your career is you're there to help people. I don't really like people that much. That's why I gravitated towards the ICU. But yeah, that is the ideology of nursing, is to help people. I went to ICU because when I went to my clinicals, I noticed that all of the patients were sedated and intubated, so they couldn't talk to me and they were asleep. So it allowed me to use that mechanical mind where I didn't have to communicate with the individuals. I could just look at them like a machine. This part's broken, this and this happened, we need to fix this to correct this, this and this. So it's more of the mechanical, you just go in, do your work, you don't have to really communicate a whole lot with patients.
Do you think that mindset is something that's needed to be a successful ICU nurse?
I believe so, because I've seen a few ICU nurses that really have more of that compassionate side and really want to communicate and have that face-to-face with the patients. And you don't get a lot of that in the ICU. So if you don't have that mechanical mindset to where you don't need to be communicating with patients on a daily basis, it turns out better for you in ICU. I've seen a lot of nurses leave the ICU because they don't have that face-to-face connection and communication with the patients.
Do you have any funny stories from nursing school?
Oh my gosh, I got a bunch. How many do you want?
Just one.
Okay. So in the whole nursing class, nursing is a female profession dominantly, and there was one other guy in the nursing class with me, and we had a practical day where we learned how to put in NGs and Foleys and all that kind of stuff. I took home a Foley and he took home an NG tube, and what we were going to do when we went home is we were going to put them in on ourselves. So we flipped a coin. Actually, I think it was rock, paper, scissors who was going to get the Foley, and I drew the short stick on that one. And so I inserted a Foley on myself and he did the NG on himself. And then we drank a little bit, and I realized that the Foley was very nice because I never had to get up to go to the bathroom. It just automatically drained out.
For layman's terms, can you describe what a Foley and an NG tube are?
Yeah, Foley catheter is a tube that goes into your urethra, into your bladder, and is inflated with a balloon, so it sits in your bladder and doesn't fall out. And then all the urine just automatically goes down the tube into a holding bag. That's a Foley. And then an NG tube is a tube that goes from your nose down into your stomach so that we can give you feeding if you can't eat. A lot of people who are intubated get an NG tube so that we can give them feeding and medications.
You definitely drew the short stick on that one.
In the initial, yes, but in the end part, when I didn't have to go to the bathroom, that was nice. So
if you could tell young John, nursing school John, anything, what would you tell him?
Stop now, choose something else. Yeah. Pretty short and sweet.
Can you describe your first nursing job?
My first nursing job was at a psychiatric facility. I'm not going to mention the name because I don't know if I'm allowed to, but I was in nursing school. I was a tech at the psychiatric facility, and then once I got my nursing license, I moved to a nurse there in the pediatric psych unit.
Did you enjoy working with kids more?
Yeah, because for the most part, kids are innocent and they didn't really do anything to themselves to get them in this situation. A lot of patients that we'd have in the ICU were drug addicts, alcoholics. Yeah, that's pretty much it. Drug addicts and alcoholics. And it was a very rare occasion that you would get someone who was actually sick just from getting sick, nothing they did to themselves. And it gets tiring when you're taking care of the same patients over and over, and they just don't realize, hey, if I quit heroin, maybe I wouldn't be in the hospital so much, or hey, maybe if I quit drinking, I wouldn't need a liver transplant right now and be in the hospital every 2 weeks. That's what working with kids was more beneficial to me, is because they were innocent. They didn't do it. My second nursing job is I went into a program at a sister, or the main hospital of the psychiatric hospital, in the medical ICU, and it was kind of a training program. So I had like 6 months of orientation and on the floor training before I went directly into the ICU, because they don't hire new grads without having prior experience, so they started this program to get more nurses into the ICU.
And what level hospital?
It was a level 2 at the time. I believe it's a level 1 magnet hospital now. It was a large level 2, and by level 2, that's their trauma rating. So a level 1 can take anything. They don't have to send anybody out. We had a large level 2. We didn't need to send anybody out. The only reason they didn't have the level 1 when I was there is because they didn't have a neurosurgeon on staff 24/7. So that once they got that, they were able to get the level 1 trauma certification.
So for new nurses that are starting out as a staff nurse, kind of describe what it felt like to be a baby nurse.
God, it's been so long ago, I don't even know if I can accurately describe it. In nursing school, they had this adage of the old nurses eating their young. And that happens quite a bit. I don't know if it's like a hazing process to see if you're going to make it or not. A lot of the older nurses can be very rude and judgmental and throw you under the bus a lot politically. You wouldn't think it, but the hospital is a very political machine. And if you're gonna go into nursing and you're gonna be a baby nurse, just realize that you're gonna get crapped on. You're gonna get the crappy assignments. People are gonna throw you under the bus. Just stand your ground. And then when you get to the point where you're training new grads, remember how they treated you and do the opposite. When I had new grads that I was training, I was always attentive and I didn't try and belittle them or make them feel stupid. It's just treat people how you want to be treated, and that wasn't present when you're a new nurse, or when I was a new nurse. Travel nursing gives you the opportunity to travel the country and get paid for it, and my wife and I both knew that we didn't want to live in Indiana, especially after a really hard winter that we had. And a couple of my friends, when I was a staff nurse, said that they were going into travel nursing, so I did some more research on it, and we finally decided, hey, we don't want to be in Indiana, so let's travel around, get paid, and see where we do want to land. So that's how I got into travel nursing, and it pays more.
Do you regret travel nursing?
No, I don't regret. No, I don't regret travel nursing at all, because I think that allowed me to hang on to being a nurse longer than I would have if I was a staff nurse. Had I been a staff nurse, I would have changed careers 2 years into it, but I was able to make it 12 years in healthcare. So I think being a travel nurse afforded me to be in this career field longer than if I was a staff nurse.
Did staff nursing, and I'm speaking specifically for you, did staff nursing prepare you for travel nursing?
Me, yes. I've met a lot of travel nurses that their staff job didn't train them well enough to go into some of the hospitals that they were in. My home hospital trained me well enough that anything that came through that door I was confident enough to take care of. Because we're a big facility, and you have some of these nurses who come from a very small community hospital and then try to go to these big megalithic hospitals that get the worst of the worst, and they don't know what to do because all they've taken care of is the sniffles and the flu every now and then. So I think it depends on what kind of training you got before you started traveling is how well you're going to be prepared for traveling. And the people who aren't receptive to change and aren't quick to adjust are not going to do well in travel nursing. It's just, you're just not. I worked at everything. I worked from small 4-bed ICUs in the middle of nowhere all the way to massive university teaching hospitals and everywhere in between. So I kind of did a wide range of everything. And that was because I felt confident in my training that I was prepared enough to go to any of these facilities. I personally thrive better in the high-paced situations of the big university and teaching hospitals. The community, smaller hospitals are just too slow for me. I need to be active and moving.
But did you ever see any benefit to working at the slower hospitals?
Yeah, I mean, if I just came off a big contract at a university hospital and it was very hectic, it was nice to have a 3-month break where I really didn't have to do anything. So that was the benefit of it.
How many contracts did you take?
24, I believe.
So this next question, I'm going to ask you more for my benefit, but do you feel like you had to sacrifice anything to be a travel nurse?
Yeah, I mean, I feel like we both had to sacrifice. Personally, we sacrificed. We had a very close-knit family of friends that we always hang out with. We had Sunday dinners every week, and we always hung out with them. So we lost that close-knit community in place of traveling around and meeting a bunch of different people for a short amount of time. I sacrificed a lot of my hobbies, so like cars and motorcycles and working in the garage and woodworking, that kind of stuff, because you can't really do that in an RV. But I think the benefits of travel nursing outweighed the sacrifices that I made.
Where was your favorite facility and why? And it could be for people or the actual facility itself.
I think I have a couple different ones. My favorite facility for the people that I've met and the friendships that I've obtained from this hospital, Eastern Medical Center in Roswell, that is my favorite for people. Now, as far as the healthcare standard and the lack of equipment, as a hospital, it doesn't function well, but the people are amazing. As far as hospitals that function well and have very good updated equipment and stuff like that, Chandler Regional Medical Center was the most updated because it was a brand new facility and it functioned very well. They had a very good separation between the intensivists, which are the ICU doctors, and the hospitalists. A lot of hospitals merge them together so that the hospitalist can take care of ICU patients, and that's just not how it should operate. There's a reason that the ICU doctors went to extra training to be an ICU doctor, and a hospitalist is more of like a family practitioner.
In your travels, have you seen anything that scared you?
Scared me? Like, I mean, I've seen some nurses that I've had to stop from doing things so they don't kill a patient. That's scary. There has been an instance where there was a physician who was reported multiple times for fraud, specifically insurance fraud, because she was kind of double dipping on procedures on patients and doing multiple procedures that weren't necessary. So that's pretty scary.
Do you feel like the entire country is up to speed, medically speaking?
No. Not even close. And especially if you go to, like, at a lot of the facilities at reservations, a lot of those are outdated. And you can kind of tell when the facility has money, they have updated equipment. When the facility doesn't have money, like a lot of the community hospitals, they kind of get the hand-me-downs of equipment. So there's no set standard really across the board for medical equipment or procedures, anything like that. It's kind of based on what the facility wants to do. Not every hospital is up to date on their procedures, and there's no set standard of protocols.
Has traveling changed your opinions of doctors?
Not really. I mean, it was kind of the same way when I was a stationary nurse. You have some doctors who are assholes and some doctors that are really down to earth and willing to help you and train you and really help you out with education along the way so that you understand what they're doing on their end to make you a better nurse. I will say that I have never met a locum physician, which is a traveling physician, that I didn't like.
Across the board, if there was one thing you could tell management for all hospitals, what would it be?
Listen to your staff, because a lot of times they're not just bitching. There is an actual real issue going on. And it seems like a lot of times when the core staff tries to mention something to management, management just takes it as they're complaining. So a lot of times that discourages the core staff from actually bringing up any issues. One thing I did when I was a travel nurse is I would go through on my last day to all the core staff and say, hey, what are these issues that you need addressed, and what would you want to say to management? Because I don't care, I'm leaving. They're not going to fire me. the core staff is afraid of mentioning something because they may get fired. When I do my exit interview, I would have that list of what the core staff's complaints were, and I would run through it line by line and just say, this is what I've seen in my 3 months here, this is the issues that you have, and they should probably be addressed. That way they come from me, someone who's already leaving, and not the core staff who needs that job because that's where they live.
Throughout all of your nursing career, so staff or travel, have you ever feared for your license?
Not necessarily feared for my license because I'm pretty good at what they call CYA, cover your ass. There has been instances where if I didn't have proper documentation or went to management about something, I could see where my license would be in jeopardy, but I don't believe that I've ever been in fear of my license.
Have you ever seen anything that was unsafe medical practice? Do you have anything you want to add to that?
No, I don't deal with it. I don't put myself in that situation where it's gonna jeopardize my livelihood for one contract or for one physician. It's not their license, it's mine, and it's your license, so you have your due diligence to protect your license and your livelihood no matter what anyone says.
So you would recommend to a baby nurse, whether or not they're a new staff nurse or a new travel nurse, that stand your ground, don't let anyone...
If you're not comfortable with it, listen to your gut. If your gut says, hey, something's not right here, it's your license, protect it, don't do it. Physicians will a lot of times have you do something that's outside your scope of practice. And if that happens, refuse it. I mean, you have the right to refuse it. If the physician wants it done so bad, they can do it, or they can find another nurse who is comfortable with losing their license. Just stand your ground and listen to your gut.
Do patients have the right to fire their nurse?
Yes. And the nurse has the right to fire the patient.
Was travel nursing what you expected?
Well, I didn't really know what to expect. So I guess in a short answer, yes. Yeah, I really don't know how to answer that.
Were you a travel nurse before COVID?
Yes, like 5 years prior to when COVID hit.
When new travel nurses started, when COVID started, do you have a different opinion than they do on what assignments looked like?
Well, I mean, yeah, because when they first came in, the assignment prices were super high because there was a crisis going on. And then, like 2 months later, when all the contracts were dropping off and the pay for them were dropping off, because the market was flooded with a bunch of travel nurses now, it really changed what travel nursing looked like. The market was flooded, and when COVID initially hit, we just didn't have the patients that we thought we were going to have. There was a time when it first hit, the hospital that I was at, the ICU didn't have patients for 2 weeks. We were just sitting there twiddling our thumbs. But the market got flooded with a bunch of new travel nurses and kind of ruined it.
New nurses flooding the travel market, do you think that, like, this is for the general public's knowledge now, do you think that affected or allowed the media to kind of create a frenzy in the eye of the public?
No, I think the media was going to create a frenzy whether they had travel nurses or not. I don't think that had any bearing on what was going to happen. I just think the flooded market of new travel nurses screwed the travel nurses who had already been in it for a while. Because all these new travel nurses that went during COVID, they said, well, I'm going to help the community. Well, the community that you were in and already working in needed help. So don't use that as your veil of false sense. You went because you saw the money. That's the only reason. I'm a little jaded against the travel nurses that have come in because of COVID. I think what a lot of the new travel nurses didn't realize is like the process of accepting a contract. So you take a contract, you maybe get 1 day of orientation. There was a lot of contracts that I didn't get any kind of orientation. So they came into this thinking they were going to get a massive amount of training, and half of their contract was going to be training, and then they only had to do the rest of the half actually working, and that's just not the way it works. That's why I said previously, if you don't adapt well to change and pick up on things quickly, you're going to fail as a travel nurse, and that's what happened with a lot of these new COVID travel nurses.
What unit did you work throughout all of COVID?
ICU, only ICU.
And was it a COVID ICU?
And sometimes ER. Yeah, pretty much when COVID hit, every ICU turned into a COVID ICU. So all I've worked with were COVID ICU patients. There were, like, I don't have any comorbidities or anything like that. And a lot of nurses got out of working on COVID units because they said they had asthma or they were obese or something like that. And so they got out of it. But I've always been in COVID since it hit.
So I'm sure most viewers are aware of that term now because it's been used a lot in the media over the last year, but can you define what comorbidity is?
A comorbidity is a pre-existing condition like diabetes, asthma, sickle cell, anemia, stuff like that.
How many states did you work in throughout COVID?
4 hospitals, 4 different states.
So you touched on this a little bit, and I want you to go a little bit more into it. Throughout 2020 and 2021, while COVID was going on, the media said that the hospitals are overloaded, the hospitals are full, the ICUs are full. What was your experience with that?
When COVID first hit, it was like pulling teeth to get a patient in there. Like I said, when it first hit, we didn't have a patient for 2 weeks. We didn't have a COVID patient for like a month, and that was the first contract. Then I went to the next contract, and the ICU was full with pretty much only COVID. And even if they did have COVID but didn't require the ICU because we had the isolation rooms, they still got sent to the ICU. So they may be a med-surg patient, but because they have COVID, they're going into the ICU even though they don't require the ICU care. So it was kind of hit and miss if we had ICU COVID patients.
Did the flu disappear?
At some hospitals, we weren't even testing for it. We were just automatically testing for COVID. And at the last contract I was at, they were testing for COVID and flu. And a lot of them would come back positive for flu and COVID, but since COVID took precedence, they were just labeling them as COVID and not labeling flu on the chart. I don't think it disappeared. I think just a lot of hospitals weren't testing for it.
Can you tell us about PPE, and was it the same across the nation, like from facility to facility?
So PPE is personal protective equipment, so mask, gloves, gown, that kind of stuff. And it varied a lot between the two hospitals, or between the hospitals, depending on how much money the hospital had. So there were some facilities that had like a full hazmat suit with the capper, which is like a positive air filtration system. It's a whole mask, hood thing, and gown. And then some just had a mask and a regular cloth gown and gloves. So it was kind of dependent on how much money the facility had to put into the PPE for their workers.
The different level of PPE at different facilities, do you feel like that gave a message to nurses that some people working at certain facilities' lives were more valuable than others?
You can only operate on what funds the hospital has, so I don't think it was concerning. I mean, we're trained on everything. I think as long as you have a sufficient respiratory barrier, then you're okay. I mean, there was a lot of facilities that only had N95 masks, but I told them, like, if you want me to work in this facility, I'm going to have my own respirator, which is a P100, which is above and beyond what an N95 does. The PAPRs, I felt comfortable with those because it was a positive air filtration system. So it's kind of like the P100. So it's kind of on the same level. But I mean, we were trained in all of it, so it's kind of whatever you were comfortable with. I mean, when it all first started, like, we were just wearing normal surgical masks.
What demographic of patient did you have in the ICU?
It was very interesting because the majority of the patients that I got were African American, Hispanic, or Native. And I didn't have my first white patient until I went to Montgomery, Alabama, which was my last contract that I just did. So for the longest time, it was only Native American, Hispanics, and African Americans that I was taking care of. And I know there were white patients in the medical or med-surg side of it, but I never had one in the ICU.
Was there any difference from your typical female to male ratio or age ratio? Was there any difference between a COVID patient and a normal ICU patient for you?
Not really. I mean, it kind of hit male and female the same. If they had comorbidities, they were hit harder, and if they were older, they were hit harder. So it's really, that's what we always deal with in the ICU, is if you have a lot of comorbidities and if you're elderly, a lot of times you're in the ICU. So it was kind of the same. It was just the gowning up process to go into the patient's room that changed.
Correct me if I'm wrong, but I believe it was 2018 was a horrible flu season.
Yeah.
So did you notice really any difference between 2018 flu season with people dying with comorbidities versus the last year with COVID with comorbidities?
Yeah, people with the flu that year that had comorbidities, they'd be on the ventilator for a long time. But I feel like more of them came off of the ventilator, and it seemed like every patient that I had with COVID that was on a ventilator passed away. The whole time I had one patient come off the ventilator with COVID. Compared to the flu, I get quite a few of them off of the ventilator. So,
what annoys you now because of COVID that didn't annoy you before?
Well, it always kind of annoyed me before, but the general lack of common sense and thought process that everyone has now. It's like, okay, for an example, at one of the hospitals I was at, they have to get into the medical or the medicine cabinet. You have a keypad and you have a biometric touchpad, so you can use your fingerprint to open up the medicine cabinet. Or you can type in your username and your 16-digit password. So some manager got the bright idea that the biometric scanner was too much touching and caused the risk of contracting COVID, but typing in your 16-digit password was not as contagious as just touching it once. So it's that lack of common sense, like, instead of touching it once, let's touch it 16 different times, because only the biometric scanner gives you COVID and the other keypad doesn't. So it's just the lack of common sense and the general stupidity that has run rampant through this country is just asinine to me. Here's one in general public. Going to a restaurant. When you walk in, you have to wear a mask. But when you're sitting at your table or going to the bathroom, you don't have to wear a mask. How is that logical? It's just, this wasn't meant to be a rant.
You talked slightly about it earlier, but what happened, can you go into a little bit more detail? What happened with the travel nursing market when COVID first hit, the amount of jobs?
When it first hit, I think everyone thought there was going to be a massive surge, and there just wasn't. So contracts were getting canceled left and right, and hospitals weren't putting in bids to get new travel nurses. So the market was pretty much non-existent to get a new contract. And then as it started to pick up, there were more contracts, but that's when the flood of new travel nurses for COVID came in. And then kind of the same thing happened. Once the market got flooded, the contracts dropped off, and it was difficult again to find another contract. So,
speaking to COVID specifically, do you feel that non-COVID unit nurses need to kind of stay in their own lane? Like when talking about COVID.
It's kind of like the adage of, if you don't vote, you can't bitch. If you haven't actually worked it and you haven't seen what the COVID nurses go through, you really can't speak to it, because you have no grasp of what we've gone through and what we've done, and you can just sit like on the internet and bitch about it all the time while you're working in the nursery with babies and not dealing with it. So yes, I feel like they need to stay in their lane because they don't know firsthand what we've had to deal with.
Do doctors deserve paychecks
Nope.
in the ICU over the last year?
Nope. There are maybe 3 doctors that I would pay, because they would actually gown up and go into the room, and I have so much respect for those individuals. The other ones who stand outside the room and make the nurses go in and do their assessments and tell them what to put in their charts so that they can bill that they've been with the patient for an hour, bullshit. You don't deserve a paycheck.
What message?
Same thing with the physical therapist who didn't go in the room. Same thing with dietary who didn't go in the room. Same thing with housekeeping who didn't go in the room. If you did not go in that room, you did not complete your job, you do not deserve a check.
What type of message do you think that sent to all the nurses that were doing everyone else's job?
That their life was more valuable than ours.
So with everything going on in the world right now, and everybody so hot button topics on everything, should politics stay out of COVID discussion?
I mean, you really can't, because they have healthcare advisors and they have the FDA, which is government based. You really can't. Sure, they should stay out of everything, but that's my own political beliefs, but it's never going to happen.
Mm-hmm.
So it doesn't really matter. It shouldn't be you're Republican, so you're anti-mask, you're anti-vax, you're all this stuff, or you're Democrat and you're always wearing a mask and you're the only ones getting a vaccine. That's not the way. It's a personal decision. So do whatever you want, but don't label it as Republican or Democrat, because that's not the way it is.
So as a nurse,
Mm-hmm.
you've been trained to keep things sterile.
Yes.
So when you go in public and you see social distancing and safe practices in place, do you feel that those type of things are working?
No. It's pointless. There's so much cross-contamination between everything that everyone does. Like when you're going to get your fast food and they have their plastic gloves on. Well, we've seen multiple times that the girl reaches in her back pocket and touches her phone and then puts it back in her back pocket, and with the same gloves on, hands you your drink and then takes your credit card from you and pays and rings you up and then hands it back to you and grabs your food after she's just done touching her hair. All that has been cross-contaminated. So unless you're going to change your gloves between every little thing that you do, it's pointless.
Like the contactless where they put it in the tray.
They still have to grab it to put it on the tray. It's not contactless.
Do you have any memories from nursing that really hit home, like hit you hard, like a patient that really affected you?
Only one. I've only had one patient that has really affected me, and it wasn't even when I was an actual nurse. I was in nursing school that it happened. And it was a little girl in the pediatric cancer center that had beat leukemia. And I'm just going to tell the story because they're going to be confused if I don't. Okay. I had one patient when I was a when I was in nursing school. It wasn't actually even when I was a nurse that really affected me. I was doing clinicals on the pediatric oncology floor, and this little girl had just beat leukemia. She was so excited because the next day she got to go back to school, and I found out the next day that her and her mom was killed by a drunk driver on the way to school. So she had just beat leukemia and then died on the way to school. So that's the only one that's ever affected me.
Did you quit nursing because of COVID?
No.
Why did you quit nursing?
I quit nursing because I was over the BS. When I first started nursing, it was about patient care, and it was about getting the patient better. And then slowly, with all these surveys, and it's become more of hospitality than it has hospital care. Nurses now get their raises based off of patient satisfaction scores. So if they don't get, if their coffee isn't hot enough or if their pillow isn't fluffed right, then the patient gives the hospital a bad score, and then the nurses don't get a raise, which is BS, because we got you better and got out of the hospital, so it shouldn't matter how hot your coffee was or how soon you got your food. So once it really started to shift towards hospitality, and it just got worse and worse and worse and kind of turned into customer service, it was time for me to get out.
And on March 8th of 2021, NPR wrote an article, and they titled it, "War Doesn't Even Compare, A Year in the Life of a Traveling Nurse." So,
Bullshit.
So,
talk to someone who's actually gone to war.
Well, hold on. So it says 1 year ago, a man named Grover treated his first case of coronavirus. Since then, the traveling nurse, a military veteran, estimates he's seen 3,000 people die as a result of the disease. So that would be 8.29 patients a day.
No. Not possible.
So does a statement like...
Hold on. So he's a Army veteran or a military veteran.
Mm-hmm.
Okay. What was his job? Was he a door kicker? Was he actually on the front line, or was he a paper pusher in the background?
I don't know. It just says he served in Iraq and Afghanistan. It doesn't state whether or not he was a nurse or not. So the article goes on to say that his most memorable patient he has treated during this pandemic was a black woman in her 30s whose twin sister called every day. I would sing her church hymns, Street recalls. Her sister said that she would love me to pray with her, and I would do that just for the sister and for the patient. She was the first patient that I have ever had in 20 plus years of being a nurse that died on me. So how do you take
So
that?
in 20 years, he hasn't had a single patient die until this woman?
So do you think that articles like this have put more fear?
It's false. It's 100% false. Because I've only been in the healthcare for 12 years, and I've had multiple patients die before COVID. That is complete and utter BS.
So the article goes on and says, the American Association of Colleges of Nurses says that several factors are contributing to the shortage in nurses, including insufficient enrollment at faculty and nursing schools to meet the demand, a significant number of nurses reaching retirement age, and the high stress levels that are driving nurses to leave the profession. And on top of that, healthcare workers are also falling ill and dying from the virus. So can you speak to any of that?
I mean, I haven't had a single colleague of mine die from COVID. And nurses are getting older because for what nurses deal with, we don't want to, there's so many better careers where you don't have to deal with this shit and make more. Older nurses have already been there, and they were there when it was hospital care, not hospitality. And they got pensions, and now they're so close to retirement, they're just saying, I'll deal with it for a little while longer because I'm about to retire with a full pension. It's not the same now. It's not what it was even 12 years ago.
So do you feel like there is a shortage of nurses?
Yeah. Because you have people like me that are fed up with it and are getting out of it. Or you have them that are going to desk jobs that their nursing degree will work with, or they don't want to do bedside anymore because it's BS. Or you have a lot of nurses that are going to nurse practitioner school and flooding the market with nurse practitioners because they don't want to deal with the bedside day to day. They've taken all of our support staff away from us without giving us adequate compensation for it.
So the last part that I want to pull from this article is a direct quote from Grover Street, the guy that this article is written about, the veteran. And it says, he said, "It's like playing Russian roulette. You're risking your life to go in a patient's room," says Street, who works with fast staff travel nursing and is an author of a forthcoming book, Chasing the Surge, Life as a Travel Nurse in a Global Pandemic.
So he is one of the ones that came in because he saw the money for COVID travel nursing, and now with this article, he's trying to make money off of it. It's 100% what it is.
Should the public be scared?
Scared of what?
COVID.
I mean, they should just have a general fear day to day of everything, not necessarily COVID. I mean, you're just as likely to walk out to your car and get in an accident and die on the freeway. You're probably more likely to die on the freeway in your car than you are from COVID. Not to mention there's hundreds and thousands of other diseases, TB, malaria, measles. I mean, there's so much other stuff. To just focus on one is ridiculous. So you could trip, fall, hit your head on a rock, and die. You could die from COVID. Everybody's got to die of something.
Will you get the vaccine?
No. I don't even get the flu vaccine because I have like major reactions to the vaccines. So I won't get any vaccine. It's one of the main reasons I got out of healthcare. And who knows if it actually works. Look how long it took to get the flu vaccine. And then this rolled out this quick, and they're saying it's effective. Who knows? The flu vaccine isn't even effective. And it took them that long to create the flu vaccine, a flu vaccine. So, who knows if it's actually effective.
So if someone said to you, "I want to get the vaccine," what would you say to them?
Congratulations, go ahead. I don't care. It's your life. It's your body. I don't care. I don't care what anyone does. As long as it doesn't affect me and my family, we won't have an issue. You can do whatever you want. If you want to get the flu vaccine, perfect. If you want to wear a mask, perfect. I don't care. The issue I have is when you try and force it onto people.
Thank you.
Is that it?
That's it.
Okay, because I'm hungry.
Okay.
Am I supposed to do like a wrap up, or is it just walk off? Stage left?
You can walk off.
Okay.
Signing off for the last time. You're not a nurse anymore.
Yeah, for now. Unless I fall off another roof.